And this is the establishment of the Miriam and Aaron Gurtwirth Medical School, which is an MD PhD program. And I want to share with you the bigger picture, because you always, for years you come here and you hear that the Weizmann Institute is an institute for basic research, and you've heard here several stories about translational research and then what MD PhD do. However, the Weizmann, for many years, due to several reasons, and that was led by the president and the vice president, thought that the Weizmann Institute should be able to affect or influence and improve the Israeli medical system. And you can do that by bringing to the system better doctors, physician scientists, for example, or even non-scientists, other physicians. You can improve the national health services by improving hospitals, improving research in hospitals, investing money in hospitals or in the community medicine. And the Weizmann had several ideas. So the vice president have set a committee that his goal was to see how the Weizmann can help the Israeli medical system. And then ideas like collaborating closely with an HMO were one of them, or collaborating closely with a hospital or a specific hospital. And then the third option is really go deep into be involved in the community medicine and bring science into the community medicine, because science and community medicine currently are pretty far away. The doctors, the family physicians are overloaded with burden and they almost do no science, so the Weizmann could have invested in that. And looking through all these options, the Weizmann, this committee and the Weizmann Institute decided to get more involved. And the first step was to establish a medical school. So to educate physician scientists who will go and fill up gaps in hospitals and community medicine all over Israel. And that was the initial motivation for it. Okay, so you understand now why we wanted to do it, but did we really need to do it? So is there a real need for physician scientists in the Israeli medical system? So if we haven't convinced you so far, I will give you a few more arguments. The population is aging. That brings new diseases to the table, and diseases that are very difficult to solve and answer, because these are diseases that evolve over tens of years and their mechanisms are complicated to understand. So this puts a huge difficulty into both the medical system, but also to physician scientists and scientists in general. So that's one important need where physician scientists can step in. The amount of data accumulated both in medicine but also in science is that we are in the data revolution, and physicians who are not trained properly have really no clue what to do with all this information. So they are clueless. And they need a proper education to be able to handle data. And this is going to be one of the main pillars of our school. That our physician scientists will be data-driven. They will learn how to handle data and deduce it. The need for personalized medicine, like the case you've seen here before, unique cases that are outside of the box. The more and we understand science, the more the population is aging. We see more and more of that, and we need individuals who will be able to do that. The fact that we have more and more drugs and their response is variable needs new tools to look into this interaction between drugs and disease, drugs and the genetic of the population, and physicians who are not trained for that will not be able to handle this problem. And then the access to research, specifically in Israel for people that are either in the community or in the hospital, is limited. So there are few hospitals like Sheba where there is access to research, but most hospitals in Israel do not have access to research. And if we bring in the people who can access to research, they will develop research in these medical institutions. So now Ayelet will take you into the vision.
Okay, so we had a vision. We have to think big here at the Weizmann. So our vision was that the future physician would benefit from being a physician scientist. And so we set up our goals. And our goal, the main goal, was to develop leaders in the medical science. And what do we want our leaders to be? So we want them to excel in patient's care, but this doesn't just mean knowing the diagnosis. It means caring for the patient. We want them to drive advancement in the medical treatment, but also always have the patient in mind. And at the bottom line, we want them to have a holistic understanding both of the disease, the mechanism, how to treat. We want them to know what are the treatments that are available. We want them to care about the patient, but we want them to always think, what can I do more? Is there some research question that I can answer to better treat this patient? So it takes a village. And to help us with this, we recruited physicians from the major hospitals in Israel, physician scientists who are actively working as physician scientists, also from the healthcare system in Israel. And we also, with the help of the management, of course, received lots of administrative support. Wait, I want to highlight that everything is led by Gili and Michal from the Feinberg, no longer Feinberg, for the Weizmann School of Science. So, just to outline our program, the first year will be intense. They will have 3 semesters, no holidays, no vacations, focusing on preclinical studies. But even though it's a preclinical stage, we will, in this year, also teach them some of the basic things that are required to understand basic research. So our program will also be unified for a physician scientist. Then they will have their PhD, and during their PhD, they will get training in clinical skills. When they're done with their PhD, which will be like every other PhD here at the Weizmann, they will have 6 months of preclinical preparation just before they enter their clinical rotations. From then on, they continue just like any graduate of the Israeli med school. Throughout all these years that they are here with us at the Weizmann, they will receive medical education. So in terms of the roadmap, we're now waiting for the Ministry of Higher Education to approve our program and let us start the show. And we expect our first graduates to be in 2029. This is because some of the people that we enroll in our program will already have a PhD. So they will have a shorter program. Now, this is my favorite slide. So if you lost us up until now, this is where you need to focus. So why is our program so unique? First of all, it's the concept. We're the only place, and this is after extensive research that we do, we're the only place in the world that has this unified program that throughout the whole program unifies the clinical and the research training. Also, the content will be different because we have access to patients' data, anonymously of course, and the students will learn through real patients' data. And for this, we're also giving them some knowledge in basic computational skills. In terms of the methods that we're going to use, it's going to be in small groups, it's going to be on case-based, very, very few formal lectures, about 10%, and all the rest is active learning. Also, their PhD, they can do it in any of the departments at the Weizmann. They're not limited to the life science departments, unlike any other medical school in Israel. The students will be maximum of 40, and we're going to select them, of course, based on their excellence, but also we want them to succeed. We want them to be exactly fitted for the program so that they will have the higher chance to graduate. Our approach is that once someone enters and passed all the exams, and there are lots of exams in order to be eligible and accepted to the program, but once he passes, it's on us to make sure that he succeeds. And we have to give him everything that we can and do everything that we can so that he succeeds. And as everything at the Weizmann, there is no compromise on excellency. They have to be at the top level. In order for them to focus exactly on what we want them to focus, which is all these extensive studies, they will have no tuition fees and they will get a stipend. So because our program is so new, we're also establishing an evaluation system that is inherently built in our program, that will evaluate every step of the way, but also whether our graduates eventually fulfilled our vision. So as I said, it takes a village, and we're starting to build the biomedical village here at the Weizmann. I invite you all to join us, and I also invite now Shalev, Oran, and Liran, and we'll be happy to take any questions you may have. Thank you.